Good morning everyone. Today's topic is about facial trauma or facial injury. Whenever you think about a facial trauma, it is usually associated with the road traffic accidents. How do you evaluate and how do you manage is the main aim of this session today. So the injuries of the face, basically it can be a soft tissue injury or it can be related to bone injury or you can have a combination of both. The majority of the facial injuries are caused by automobile injuries or a quite common road traffic accidents. In spite of you can have injuries in relation to any kind of a sports injury or personal fall or accidents or assaults or during any fight issue. So the basic aim in the management of a facial trauma is to maintain an adequate airway, to maintain or to control bleeding and to deal with an associated injuries. So what is the adequate airway maintenance? The maintenance of airway should be received as the highest priority, because whenever you have an obstruction which may be due to an injury to the bone on your larynx or maybe injury on the face with an aspiration of a tooth or anything else causing a denture or anything else causing a foreign body and obstructing the airway. Sometimes a massive bleed and aspiration can also be part of an obstruction in the airway. So the airway has to be secured by an intubation or might require an emergency or a planned tracheostomy to maintain an airway. The next thing is an bleeding. Whenever you have a facial trauma, you have the major vessels going to the face. So this can bleed profusely either from the neck or you can have a facial injury causing a severe nasal bleed, which has to be a priority to control the hemorrhage. And obviously an associated injuries like your facial injuries may be associated with trauma to the head, chest, abdomen and larynx, cervical spine and limbs also has to be a part to be attended in relation to facial trauma. So the bone injuries and the management, that is what we are going to talk here more about. So the face can be divided into three regions. It can be an upper third, middle third and a lower third. The upper third, it starts above the level of the supraorbital ridge, and the middle one is somewhere between the supraorbital ridge and the upper teeth, and the lower one is related to your mandible and lower teeth. So basically when we divide into upper, middle and lower third, so anything in the upper third, as I said, is above the supraorbital ridge, is more related to your frontal and frontal bone. The middle part indicates the nasal bones, septum or the nasoorbital area, and on the lateral side you can have an injury to the zygoma, zygomatic arch, and then you can have an injury to the orbital floor. And when it comes to the maxillary trauma, you divide them into leaf folds 1, leaf folds 2, leaf folds 3. So you can see the pictures later on, but leaf fold 1 is related to a transverse one and leaf fold 2 is a pyramidal fracture and leaf fold 3 is a craniofacial disjunction or a disalignment. The lower third is more related to the mandible alveolar process. So it can be the baudible or the angle or part of your ascending ramus or the temporomandibular joint. So let us start with three divisions, and to start with the upper third face injury. So as I said, anything above the supraorbital area, so it is related to your frontal sinus. So the frontal sinus fractures may be involving either the anterior wall or also the posterior wall of the frontal sinus, and sometimes you can have a trauma to the nasofrontal duct. So the anterior wall fractures may be a depressed or a comminuted fracture, and the defect is mainly for a cosmetic purpose. So when you have a depressed fracture of your frontal sinus, you will obviously have a facial asymmetry. The sinus is approached through a wound in the skin if that is present, or through a brow incision. Either you can go through the brow and then we can approach the sinus. So the bone fragments there in a depressed fracture is always elevated, taking care not to strip them from the periosteum, as it requires your blood supply and to have a obvious continuity. So, in this picture you can see a depressed fracture here. So, the anterior wall of the sinus is always inspected, and then simultaneously you have to always check onto whether there is any associated posterior wall of fracture, because the posterior wall of fracture involves the brain, and then you can have an associated CSF leaf in case you have a posterior wall injury. Sometimes you do have a dural tears which can be covered by a temporalis fascia, and small sinuses can be covered with a fat. So, the injury to the nasofrontal duct causes obstruction to the sinuses, which may be corrected later, or you can have a later on you can have a development of a mucocele which has to be attended later. In such cases, you have to make a large communication between the nose and the sinuses to prevent mucocele formation. And as we told before, small sinuses can be obliterated using a fat. So, there is a supraorbital ridge fracture as you see in this X-ray. So, supraorbital ridge fracture usually is associated with a periorbital ecchymosis and an edema. So, you will have a flattening of the eyebrow, and sometimes if there is a edema more, you can always have an associated proptosis or a downward displacement of the eye because of the injury on the upper part. So, the fragment of the bone can be pushed into the orbit and make it impacted. The ridge fractures require an open reduction through a small incision given along the brow and or through the transverse skin line over the forehead. So, it is can be done in a cosmetic way. It goes along your brow and you do not have to put another incision to avoid a external obvious scar formation. Fractures of the frontal bone, as we discussed, one, it can be a depressed fracture like what you see here, or you can have an associated posterior table injury also. So, there may be a depressed or a linear with or without separation. They often have an associated injury along with the orbit also. And obviously, when you have a posterior wall injury, you will always have an associated brain injury or cerebral edema, which may be required to have an associated neurosurgery involvement to deal with the posterior table fracture, as you have an injury of the bone along with the brain trauma.